One of the things to keep in mind is that far too many caregivers, as we know, are facing the uncertainty of how to best care for a loved one following their discharge from the hospital. And the CARE Act will better prepare family members and friends to perform this critical task of helping our loved ones remain in their homes and to physically recover. So what is the Act itself? It was developed by the AARP, and we'll hear from the AARP in a moment, to ensure caregivers receive the information and the training that they need to care for their loved ones at home, specifically following a hospital discharge. Specifically, the CARE Act requires hospitals to do three things, all of which are of great significance. First, to provide each patient with the opportunity to designate a caregiver upon the patient's admission to the hospital. Second, notify the designated caregiver if the patient is to be discharged to another facility or back to his or her home. And third, provide the caregiver with instructions on how to perform medication management, wound care, injections, and other medical tasks for the patient when the patient returns home.
3 years ago, at the age of 92, my mom was in extremely good health and living independently. That was until she had a massive heart attack. She was hospitalized for several weeks and then moved to a nursing home. When she was released from the nursing home, I received very little guidance other than take these meds, go see your primary care physician. Those first few months after her discharge were incredibly stressful, since it seemed that so much was suddenly expected of me. This is one of the reasons that I support the concepts outlined in the proposed CARE Act. The policy would help family caregivers when their loved one goes into the hospital by allowing the individual to designate a family caregiver, provide notice to the caregiver before the patient is discharged or moved to another facility, and provide the family caregivers with the opportunity to receive plain language instruction to support their loved ones at home. People so often forget the caregiver. They are so focused on the person who needs care. The CARE Act would provide common sense, no-cost solutions that will make the big responsibilities that family caregivers face a little bit easier.
Each year in Connecticut, more than 700,000 unpaid family caregivers perform a labor of love by helping their family members stay independent and remain at home, where they want to be. These unsung heroes are the backbone of the long-term care system in Connecticut. They're providing unpaid care valued at more than $5.8 billion a year alone in Connecticut. In Connecticut, that is the value of this unpaid care is nearly twice what the state spent on Medicaid for institutional stays like nursing homes, as well as for professional services that help people remain at home. So I'm sure you guys can figure this out, and we'll hear more throughout the day, but many caregivers are on call 24/7. They're unable to take a break. They often are required to perform complex tasks such as injections, wound care, medication management, things that the average person's not trained to do, and it puts a lot of stress on a caregiver. It impacts their own health, and it can result a lot of times in lower quality outcomes, including being readmitted to the hospital. The CARE Act is a common sense, no-cost solution that will help ease some of this heavy burden placed on family caregivers, and hopefully also, as the Senator remarked, help prevent unnecessary and costly hospital readmissions.